Hello everyone, I'm Dr. Bhawana Mishra. I'm a senior consultant in the Department of Obstetrics and Gynaecology at Aster RV Hospital, JP Nagar. Now, continuing in my series of health talks that I'm doing about the commonest, problems that we encounter or the commonest concerns that we have during pregnancy. The second in line would be about the sleep and the sleep posture that one should have during pregnancy. Now, actually to tell you, it doesn't really matter in the beginning of your pregnancy. So your sleep posture does not matter. What is the logic, behind this sleep posture that we recommend? The first thing is that as the pregnancy advances, the uterus compresses on the main blood vessels, and so the blood flow to the uterus itself kind of can get impeded if you are sleeping flat on your back. Now, in the beginning of your pregnancy, there are a lot of things that can lead to a disturbed sleep. The first and the foremost thing is the anxiety itself, the anxiety of having got pregnant and treading into the unknown kind of territory. And the second thing would be that, going to your washroom very often in the nights is very, very common in just when your pregnancy starts. So naturally you will have a disturbed sleep. But trust me, the position at this point does not really matter. In the second half of the pregnancy, like I said, the preferred position would be to sleep on the sides. More on the left side as it is, recommended in books and all that. That's because when you turn to your side, the weight of the uterus shifts to one side and the blood flow is not obstructed. So it is more recommended to people who have a concern like, who have been told that the baby which is growing inside of her is having some kind of a growth restriction. IUGR, as we say in our thing, intrauterine growth restriction. For such patients, we tell them to consciously sleep on the left lateral side, on the left side. Are there any things that we can, do for this kind of disturbed sleep that we come across? Disturbed sleep, trust me, is a very, very common complaint. It is not because of pregnancy per se. Because the uterus is enlarging, we do not really find a comfortable position as we sleep along, or when you turn, the ligaments kind of pull and there may be pain onto one side. The things that can improve all this is if you should consciously avoid drinking too much of fluids from evening onwards, so that you do not get up to pass urine in the night. That's the first thing. Second thing would be to restrict your salt intake again. The third thing would be to find to exercise. Maybe first thing is to exercise. When you exercise, you kind of tire yourself and all you can see is the bed in front of you. So you'd want to go ahead and sleep. Now, in pregnancy, we must understand that we really do not want to prescribe any medicines just for you to sleep, a sedative or a tranquilizer, because it eventually affects your baby. You know about it. So these kind of measures that will actually help you. Avoid any kind of daytime sleep. Maybe if you really feel like it, after your lunch, you can catch on a small nap and come back after your exercise, have a hot water shower. It need not be very hot, lukewarmish kind, and then relax at home, put some relaxing music. Do not keep your gadgets away, keep your phones and tabs away. Do not watch something like a crime story or something. There's something that kind of, calms your nerves, and there are a lot of relaxation music and there's a lot of relaxation techniques. Do not get stressed out, and all this itself will lead to a good sleep. Try to sleep more on your sides. If the doctor has specially told you, only then the left lateral side. So, when you are really facing this kind of sleep disturbance, then towards the very end of your pregnancy, it is sometimes advised that you sleep on a recliner, wherein the weight of the uterus is not entirely on your chest, and then you feel that you've slept much better on those days. Also, the same thing can be simulated on your bed if you use very high pillows also. As much as you can comfortably lie on. So your head is propped up and the weight of the uterus is not really falling on your chest. So, to conclude, all I would want to say is that your sleeping posture only matters, say, beyond the 24th week of pregnancy or the latter half. And with these small little things that I just mentioned, I'm sure we'll go ahead and not have these problems again. Thank you so much.